Hey guys, Tony Maritato here, licensed physical therapist, and a really great pair of questions came in the total knee replacement support group for kind people on Facebook. I'm going to read the two questions and I'm going to answer them. I think these will help a lot of people. So the first question is, does everyone need a second knee done? Either at the same time or shortly after the first? No, absolutely not. And I'll tell you that a lot of patients that I see who plan on having the first one done, get it done, thinking they're going to get the second one done. But through the rehab process, they do so well, they end up not having the second one done. Now, most people these days are taking about 6 weeks between the two knee replacements when they do have them both done. Very few people are doing them at the same time. There is some clinical research that suggests it's better to spread them apart rather than doing them together. But I've seen everything. I've seen patients who have them both done on the same day and have an amazing recovery. I've seen patients who spread them out 6 weeks or longer. I've seen patients who get the first one done, do so great, they don't even need to get the second one done. So there is no real consistent pattern. It's unique to the individual. The second question here, I think, is a good one. I have not had anybody ask me this. So the question was, is it common for a person to need a hip replacement after having the knee replacement because they had improper gait while walking during the first first knee replacement? So that is a really interesting question. Now, we do see situations where when the knee gets replaced, it completely changes the gait pattern. And while I wouldn't necessarily, quote, blame the knee replacement for the problems that develop at the hip, I would say that the body is an amazing machine. It creates compensations all the time. Nobody is perfectly symmetrical. Nobody moves perfectly. So the reality is, if you had a severe varus or valgus, in other words, the knee was caving out or the knee was collapsing in, then you get a knee replacement, and now all of a sudden we go from this curvature to a straight line. It is going to change the stress that gets felt through the hip and the ankle. And so there are cases where the patient was probably getting along okay at the joints above and below the knee before the knee replacement. Now the knee replacement has happened. Now they're doing a whole lot more activity. The knee is feeling better, functioning better. And all of a sudden, it's not that the knee caused the person to need a hip surgery, but it's that the knee has kind of changed the alignment and revealed some of the problems that were underlying in the hip that you just weren't aware of before. So it's not very common. I can't think of a single person off the top of my head that had a knee replacement and then that triggered them to end up having to have a hip or an ankle replacement or any other kind of surgery. But mechanically, I can understand how one would contribute to the other. So great question, guys. Keep the questions coming in. If you're not a member, it's a free Facebook group, the Total Knee Replacement Support Group for Kind People. Go check it out. I will see you guys on the next video.